What's happening to the health system in China? Why are hospitals overflowing with patients, specifically children with respiratory illnesses? As we enter the winter season, hospitals in Beijing and northern China are experiencing an unprecedented surge in children suffering from respiratory illnesses. This surge is the first of its kind since the country relaxed its COVID-19 controls. Wait times in hospitals are stretching to hours on end, with throngs of patients queued at children's hospitals. Even the Beijing Children's Hospital is no exception, receiving over 7,000 patients daily, far exceeding its capacity. But what's causing this sudden influx of patients? The surge is primarily attributed to typical seasonal illnesses, influenza, the respiratory syncytial virus, known as RSV, and mycoplasma pneumonia. These illnesses are not uncommon, particularly during the winter months, but the current situation has raised eyebrows and concerns alike. The World Health Organization, or WHO, has reached out to China for more detailed information on the increase in respiratory illnesses and undiagnosed pneumonia in children. In response, Chinese health officials have indicated that there is no evidence of a novel pathogen triggering these illnesses. However, the limited public data available makes it unclear if there has been a rise in such illnesses among children compared to pre-pandemic years. Chinese parents are understandably anxious about the crowded hospitals and long wait times. The National Health Commission has advised them to seek primary care or general services instead of rushing to large pediatric facilities to avoid overwhelming the already strained health system. The surge in hospital visits coincides with the relaxation of COVID-19 controls, but it's important to note that social factors and increased awareness of disease outbreaks may also be contributing to the current situation. Prompt reporting and monitoring of respiratory illnesses are vital in the context of the ongoing pandemic. While the Chinese health officials state there is no evidence of a novel pathogen, experts from outside China are calling for more information. Only with transparency and collaboration can we hope to understand and address this surge in illnesses. How are the Chinese people reacting to this health crisis, and what actions are being taken to manage the situation? In the face of this health crisis, Chinese parents are voicing their concerns about crowded hospitals and long wait times. These are not small issues. Imagine the anxiety of having a sick child and then having to wait for hours, surrounded by hundreds of other patients just to see a doctor. It's a testing time for families, especially with the Beijing Children's Hospital receiving over 7,000 daily patients, far exceeding its capacity. The National Health Commission, or NHC, is not turning a blind eye to these concerns. They've advised parents to seek primary care or general services instead of rushing to large pediatric facilities. This is a strategic move to alleviate the overwhelming pressure on these hospitals and ensure that every child gets the medical attention they need in a timely manner. But there's another side to this story. The surge in hospital visits coincides with the relaxation of COVID-19 controls. This raises the question, could the loosening of these controls have inadvertently contributed to the spike in respiratory illnesses? It's a question that can't be ignored. Yet despite these concerns, there are challenges in getting a clear picture. Limited public data makes it difficult to determine whether there has been an actual increase in respiratory illnesses among children compared to pre-pandemic years. But this doesn't mean we can't learn anything. Social factors such as increased awareness of disease outbreaks may have contributed to the current situation. Despite the limited public data, the importance of prompt reporting and monitoring of respiratory illnesses is clear, especially in the context of the pandemic. It's a wake-up call for everyone, reminding us of the need to stay vigilant and proactive in our collective fight against disease. What can we learn from this situation, and what questions remain unanswered? From the surge in respiratory illnesses among children in northern China to the stretching wait times in hospitals exceeding their capacity, we've embarked on a journey through a complex health scenario. We've seen the potential influence of social factors and an increased awareness of disease outbreaks which might be contributing to the current situation. At the same time, we've touched upon the concerns raised by parents and the advice from the National Health Commission, urging them to seek primary care or general services instead of rushing to large pediatric facilities. We've also highlighted the timing of these events, coinciding with the relaxation of COVID-19 controls. Yet, many questions remain unanswered. Is there an actual increase in respiratory illnesses among children compared to pre-pandemic years? Or is this surge a result of heightened vigilance and awareness? Reflecting on these events, the importance of transparency and data sharing in managing health crises cannot be overstated. As we grapple with these challenges, it's crucial for health officials to share information promptly and for all of us to stay informed. As we continue to monitor the situation in China, one thing is certain: maintaining a robust and transparent health system is crucial in times of crisis.